Hello and welcome. In order to broaden our understanding about family life and emerging health issues, this theme talks about health, safety measures, and disease control. Specifically, control of pandemic diseases such as coronavirus, Lassa fever, and Ebola. But first, let's take a look at health.
The term health has been defined as the quality of peaceful, emotional and mental, social well-being, which enable one to live effectively and enjoy life. Health is a quality individual that leads to the total development of the body and its various systems, and not merely the absence of disease or deformity. Health is a positive quality of life which is concerned with all aspects of the whole person. When we look at pandemic is defined as an outbreak of disease occurring worldwide or over a very wide area, crossing international boundaries and usually affecting a large number of people. And
safety measures.
Safety is the state of being safe, the condition of being protected from harm or any other non-desirable outcomes. While safety measures are activities and precautions taken to improve safety, that is, by reducing risks related to human health.
Then, disease control
is the operation or action taken aim at reducing the incidence of disease, risk of transmission, and effect of infection.
Let's start by taking a look at coronavirus. What is coronavirus?
COVID-19 is an infectious disease caused by a newly discovered virus. Some people infected with COVID-19 will experience respiratory illness and recover without getting special treatment. Older people and those with medical problems like cardiovascular disease, cancer, are more likely to develop serious illness. New variants of COVID-19 was officially reported by the United Kingdom to the World Health Organization in December 2020. The new variant may be 30% deadlier than the previous strain. Other new strains were found in South Africa and Japan. The signs and symptoms of COVID-19 include fever, tiredness, cough, short of breath, ache and pain, sore throat, diarrhea, nausea, running nose, and so on and so forth. The mode of spread of COVID-19. 1. It can be through human to human, through sneezing, coughing, talking, or sharing tools. It can also be from gastrointestinal secretion like feces, saliva, and so on. It can also be spread through sexual intercourse, that is through semen and other fluid like blood, urine, and tears. It can also be spread through mother to child, that is through breastfeeding.
What are the safety and control measures?
Be well informed about the disease. Wash your hands regularly and thoroughly with soap and water. Clean your hands with alcohol-based hand sanitizer. Avoid overcrowding. Maintain at least 1 meter distance between you and people coughing, talking, or sneezing. Avoid touching your face, nose, and other things. Then, stay at home if you feel unwell. Stop smoking and other activities that weaken your lungs. Last one, then avoid unnecessary travel.
What are the vaccines and treatment of coronavirus?
The various vaccines developed against COVID-19 are 1. AstraZeneca and Oxford, 2. Novavax, 3. Pfizer-BioNTech, then lastly Moderna. 2 doses of the vaccine are recommended to confer adequate immunity.
What is Lassa fever?
Lassa fever is also known as Lassa hemorrhagic fever. It's a type of viral hemorrhagic fever that the first case of it was in Lassa, Borno State, Nigeria. Lassa fever is relatively common in West Africa, including the countries of Nigeria, Sierra Leone, Guinea, and Ghana.
What are the signs and symptoms of Lassa fever?
Signs and symptoms of Lassa fever include fever, weakness, headache, vomiting, muscle pain, bleeding from the mouth and gastrointestinal tract.
What is the mode of spread of the disease?
The mode of spread of Lassa fever includes 1. Contact with the urine or feces of an infected mouse. 2. Direct contact between people through blood fluid like blood, saliva, and so on and so forth.
What are the safety and control measures?
Isolation of the infected person, decreasing contact with mice, having a cat to hunt the vermin, which is the mice, storing food in a sealed container, fluid replacement, and blood transfusion.
And what is the treatment and vaccination of Lassa fever?
Ribavirin, an antiviral drug, has been used to treat Lassa fever. Patients should also receive supportive care consisting of maintenance of appropriate fluid and electrolyte balance, oxygenation, and blood pressure, and treatment of any other complicating infections. There is no vaccine available yet against Lassa fever.
What is Ebola virus disease?
It's a viral hemorrhagic fever of humans and other primates caused by Ebola virus. The symptoms start between 2 days to 3 weeks after contracting the virus. Then there will be fever, sore throat, muscular pain, headache, vomiting, diarrhea, rashes, then decreased function of liver and kidney. The mode of spread is through direct contact with the body fluids, such as blood from infected humans or other animals, through contaminated items, through the air between primates and human, then through sperm and milk of a person after recovery from Ebola may carry the virus for several weeks to months. Then it can also be spread through fluid vets, contact with the infected dead body.
What are the safety and control measures?
Rapid detection and tracing of the person who has been exposed should be done. 2, quick access to laboratory services. 3, care of those infected. 4, proper disposal of the dead through cremation or burial. 5, avoiding bushmeat. 6, thoroughly cooking meat before eating it. 7, wearing protective clothing. 8, washing hands when around an infected person. Then lastly, take Ebola vaccine. The vaccine is given as a single-dose vaccine and has been found to be safe and protective against Ebola. There are currently 2 treatments approved by U.S. Food and Administration to treat Ebola, which are Emazev and Evenga. Patients should also receive supportive care consisting of maintenance of appropriate fluid and electrolyte balance, oxygenation, and other treatment of any other complicating infections. Thank you.